Thanks for coming, guys. Well, first of all, I have to tell all these pregnant moms that I'm sorry it's been 110 degrees outside every day, so I hope you're going to start feeling some relief very soon because it's been horrible even for a non-pregnant lady. So I had my third child a few years ago, 4 years ago on July 31st, so I remember what it's like to be pregnant in the middle of summer. So for getting started, I'm just going to kind of go over these newborn things that you probably have questions about, how to find a pediatrician, what to ask, what to expect when you go to the hospital, what to expect when you take the baby home. And if you have any questions, we'll go over those at the end, but hopefully this will answer some of your the usual questions that we get from parents about what things are going to happen here in the next little bit before that baby comes. And I think I have 3 children, and I think being a parent is great. And so I think you're going to have a great time. It's a lot of fun. It's hard, but fun. And so we are here to help you as your pediatricians, to help you along the way and make sure that we can have a really great experience being a parent, help you get the most out of it and have a healthy baby. So parents always want to know, what do I need to do ahead of time to get ready for this baby? What do I need to do? What books do I need to buy? Is there a class I need to go to? I think the classes can be a little bit helpful so that you just kind of get the lay of the land before you show up at the hospital to deliver. Breastfeeding classes are offered at most of the hospitals around here, and I think they're usually pretty helpful as far as giving you some tips on what to expect with nursing. So I think that's a good idea if you're planning to breastfeed, to try to go to one of those. They still do a lot of the Lamaze, or I think they just call it like a birthing class now. And that can be helpful as well to kind of prepare you for what labor and delivery might be like and give you some strategies to help with pain and things like that. But all of those things definitely give you some tips, but it's still not the same as experiencing it in real life. So sometimes it doesn't always go the way they tell you it's going to in class. So hopefully those kind of things will be helpful. And obviously things like this are helpful as well. Some parents like to go on a hospital tour just to see what the hospital looks like where they're going to deliver. And I think most of the hospitals around here would do that as well for you. Just show you what a room looks like, show you what the nursery looks like. One thing you might want to ask is whether the hospital has a NICU. I think most of the hospitals in town do now. The only ones that wouldn't have some type of NICU would be Midlands Hospital, and then I think Emmanuel, I don't think even does really much of deliveries anymore. So most of the hospitals in town are probably going to have some type of NICU. How big of a NICU it is or how ill of babies they care for is variable depending on where it's at, but that's helpful because if your baby has trouble right after delivery, trouble breathing, it's nice to have somebody that's right there in-house. Most of the pediatricians in town are not right next to a hospital anymore, so if they call us about a baby having trouble, it's going to be a little bit of time for us to get there, so it's nice when they have someone that's right there in-house that can start assessing the baby. And then a lot of parents like to come and meet the pediatrician beforehand, and we do those visits all the time at our office. We sit down with you for about 15 minutes and tell you what things are like at our office, how it works when you have the baby, what our hours are. You can make sure that we take your insurance plan, and then ask any questions that you might have about how things work at that clinic. It's nice to have a pediatrician that's board certified or a physician that's board certified. And so that's another thing to check for. They should have the initials FAAP after their name, and that means you're board certified with the American Academy of Pediatrics. So that means we're trying to stay up to date on all the latest information in pediatrics. I think another big question if you're a first-time parent is what kind of things do I need to buy for this baby? And the one message I would give you about that topic is that the most expensive isn't always the best thing, and all the bells and whistles aren't always necessary, and you probably don't need everything that everybody tells you need. But the things I think that you do need or that are helpful to have, obviously you need a place for the baby to sleep, and so you're going to need a crib of some sort. Firm mattress, I think most of the crib mattresses they sell are pretty firm. But if you would borrow an old one from a friend or something, you want to make sure that it's not a really soft, squishy mattress, because we know that a soft sleeping surface is a danger for SIDS for babies. You don't have to spend your money on the fancy baby quilts with bumper pads, because really you're not supposed to use those at all. So It looks pretty in the showroom, but you don't really ever use it. So it's kind of a waste of money, I think. But as a mom, it's very tempting, I know. So think about that. You really just need sheets and, sheets for the mattress and, maybe some little blankets to swaddle, but you really don't need any fancy bedding. I think personally, having had 3 kids, that a bassinet is really great when you have a newborn. I didn't have it with the first one, and then I got one for the other 2. And that's really nice when you have a little baby and you're breastfeeding, and you can have that bassinet right by your bed at night. So you could take the money you were going to spend on the crib bedding and buy a bassinet instead. But the newborns tend to sleep better when they're in a smaller space. So sometimes you lay this newborn baby in this big crib and they are just fussy, and they're used to being swaddled really tight inside mom in the uterus, and so they like being in a smaller confined space. So a crib can be kind of cold and scary for them, and they get kind of fussy in there sometimes. So a crib you don't even probably really need when you first bring the baby home, but once they get to be a couple months old, that's when you might transition them over to the crib. You're going to need a car seat so you can take them around and take them home from the hospital. You want to make sure that it's an infant car seat that has a 5-point harness, so it's going to have a buckle on their chest and a buckle in between their legs, and that's called a 5-point harness. And you always want to have that rear facing in your car. Most of the ones people use now are the little carrier that has the base that you can put in, and you can have multiple car seat bases for your different cars if you want. And those are pretty easy to install, rear facing. And if you do get one from a friend or a family member, the 2 things I would tell you is that you want to make sure it hasn't expired. I didn't know this myself until I was having my 3rd child, and someone told me. And if you flip the car seat over, stamped in the plastic is an expiration date, and it's about 6 or 7 years after they make it, it's expired. And I think that's because the plastic can break down a little bit and maybe not be as secure if you were in an accident. And then you also want to make sure that it's never been in an accident. So if you're getting a used one, you want to ask and make sure that they've never had it in an accident. Same thing, they worry that the structure could be compromised, and then it might not be safe if you had another accident. So you're always supposed to get rid of them if they've ever been in an accident. A stroller is nice. There's a million different kinds. There's the strollers that snap in the baby carrier. There's the jogging strollers. There's all different kinds in between. So that really depends on what you think you're going to be using it for and how often. And again, I don't think that more is necessarily better. I think that in the end, I sort of liked the smaller strollers that were easy to fold and stick in my trunk were my favorite. And again, if you can find a used one, I think that's fine. Baby monitor, I think in this day and age, it's nice to have, because if you want to go to a different part of the house or outside and the baby's inside when they're a little bit older, sleeping, then you can keep an eye on them. They have a lot of fancy ones now, video monitors and things like that, so it is up to you. But in the beginning, if the baby's right by your bed, you're not going to need the monitor anyway, so that might be something you can wait on a little bit. I thought a little seat to lay them in. I know they have a bunch of different kinds now. They have those rock and plays, bouncy seats, things like that are nice to have too, as another place to lay the baby. And then feeding supplies, so breast pump or bottles, if you're going to be doing any bottle feeding or pumping later and bottle feeding, it's nice to have that. The other thing, I don't know if I have it on another slide, but if moms are breastfeeding, I think a boppy pillow is really nice. That's like a U-shaped pillow that you kind of use to help support the baby when you're nursing. And that's actually a nice thing to take with you to the hospital, because the beds in the hospital aren't always really conducive to getting in the right position to breastfeed. And it's nice if you have that pillow, you can kind of help. And there's a bunch of different brands. That's just one of the main ones, but those pillows are nice to have. And then later, a high chair, but again, that's not something you're going to need right away. All those different toys, high chairs, exercisers. We do kind of avoid walkers. We don't really recommend using a true walker with wheels on the bottom, because we worry about a baby falling downstairs or tipping over. So if you're going to get anything like that, you just want one like an exerciser that has a stationary base where they can't move anywhere. But yeah, definitely the most expensive things aren't always the best things. You don't really need a high chair that has 8 different reclining positions to feed a baby. A baby doesn't need to recline while they're eating. And I personally thought for high chairs, the best one was the one that had the least amount of crevices that food could get stuck into clean. So that would have been the cheapest one that they had at the store, was the one that had the least amount of crevices. So that was my favorite high chair. When you're packing that bag for the hospital, what should you put in it? Clothes for mom and dad. I think for mom, you want to remember that you're going to probably have visitors coming, so you could certainly wear your hospital gown, but it's not always the most glamorous thing, and sometimes it's hard to keep everything covered, so it's nice to at least have a bathrobe or nursing pajamas or something like that that you can wear when your visitors come, and that way if you need to feed the baby, you can be a little bit more discreet about it. Again, the Boppy pillow is great. An outfit for the baby to wear home, when you leave the hospital, nursing pillow, whatever kind of electronics you would like to keep yourself entertained and be able to send pictures of the baby right away, cell phone camera, laptop, iPad. Obviously, you're going to need the car seat before you go home. I will mention that if your baby is born early or small, this varies from hospital to hospital, but usually if your baby is under 37 weeks, they'll want to do what's called a car seat study on them, where they put the baby in a car seat in the nursery and they hook them up to a heart rate monitor and a breathing monitor and an oxygen monitor, and they'll have them sit there and just monitor all of those parameters for like an hour and a half. And that's to make sure that the baby isn't their head's not falling forward and obstructing their airway or something like that when they're in the car seat. And sometimes our little lower birth weight babies will do that as well, even if they're term, if they're tiny, like a less than 5-pound baby will do that. So if you have a small baby or an early baby, you might want to ask, because they might want your car seat up there like the day you deliver or the next morning, so they can do that before you go home. And so when you go into labor, what do you need to do? So you're going to talk to your obstetrician and you're going to go to the hospital and you're going to deliver the baby. And the hospital calls us, so you don't need to worry about letting us know. The pediatrician will get notified by the hospital. And most of the time we're going to come up sometime between 12 and 24 hours after you deliver the baby to check them over for the first time. And we'll do a head-to-toe exam, look the baby over, listen to them, and visit with you about how everything's going. If there's an immediate problem, like I said, most hospitals have somebody kind of in-house that can look at the baby right away. But sometimes if there's a worry after the baby delivers, then we do come up, sooner rather than later. And everybody, really at all the hospitals in town, is really pretty good about letting us know if they're having any concerns right after the baby's born that we need to come up and look at right away. And then every day that you're there, we're going to come and examine the baby again. We like to see the baby several times in that first couple days of life because we like to assess their vital signs, heart rate, respiratory rate, how they're holding their temperature, peeing, pooping, eating. And so those things are very important to us as that baby transitions from being inside mom to outside in the world. So if you have a vaginal delivery, you're usually going to stay 2 days and we'll see you at least 2 times. And then if you have a C-section, 3 to 4 days, and we'll see you every day that you're there. When the baby is born, the nurses are going to take that baby and dry him off. We kind of do that as part of stimulating the baby. That helps them remember that they're supposed to breathe. Some babies kind of forget that they're supposed to breathe now. When they're outside of mom, and so we rub them vigorously and clean them off with blankets, and that helps. It also helps their temperature. Usually they have to suction out their mouth and nose a little bit because there can be some amniotic fluid in there still, so we try to get that cleaned out. And they assess the baby's heart rate, breathing, color, muscle tone, and kind of whether they respond to pain, and they do that at 1 minute and 5 minutes, and that gives us what's called an APGAR score. So you can get 2 points for each of those categories. So the highest score you can get is a 10. Almost nobody ever gets a 10. Usually they take 1 point off for color or heart rate or something like that. Usually it's for color. But they do that at 1 and 5 minutes. And so when they call us that we have a new baby, they usually tell us what the APGAR scores are. And that's just really a snapshot of how that baby did at that moment in time. It doesn't mean that they're going to do poorly forever. But obviously, if I hear that a baby had an APGAR of 1 and 3, I'm assuming the baby didn't do well in the beginning there, and I want to know what's going on. And if the baby had APGARs of 9 and 9, then I'm glad to hear that because that means the baby looked healthy and vigorous with good color and good respiratory rate when they were born. So you probably I don't even know what my kids' APGARs were, honestly. I didn't ever hear it, so it's not a big deal if you don't know. It doesn't mean necessarily anything, but it's a little bit of information for pediatrics at that moment in time, how the baby's doing. They do put some ointment in the baby's eye right after delivery, and that's to help prevent some bacterial infections that can happen, so the nurses will do that. We recommend a vitamin K injection after birth, and that's to prevent bleeding in the newborn. Vitamin K helps our blood to clot. And until the baby gets their own bacteria established in their intestine that makes their own vitamin K, they don't really have it in their body, and so they can have bleeding. And the most serious bleeding that we see sometimes is bleeding in their brain, which can be obviously very bad and lead to seizures or deaths. So the vitamin K is just a bridge to help them until their own body can start making vitamin K. And that would be in their thigh. And then we recommend a hepatitis B vaccine, and that's pretty routine across all the hospitals here that they would ask for your consent to do that. And the AAP is the American Academy of Pediatrics, and we recommend that as a first dose for all newborns within that first day of life. So those would be things that you would have to give consent for, but we do recommend all those things. And so then what do you do? Well, you just have to have your baby. We want you to hold your baby. For mom, we would like some skin-to-skin contact in the first hour after birth. We know that helps the baby transition to the outside world, and also usually if we can try to breastfeed the baby, if you're going to breastfeed in that first hour, they usually are pretty awake and want to try to nurse, and that can really help mom's milk supply later and helps with good bonding. So hopefully they're going to take your baby and dry them off and suction them out and give them right back to mom within the first few minutes after delivery so she can hold them. And then in that first 24 hours, really, when I go see parents the first day, other than saying, gosh, congratulations, you have a beautiful baby, I think they're doing great, I'm not going to give lots and lots of information because that first day I just really want you to rest and enjoy your baby. We do like to see the baby pee and poop in the first 24 hours sometimes, so I'm checking on that. And then the nursery is going to let me know if they've had any trouble with keeping the temperature up, or any trouble with breathing, any trouble with eating, anything like that. But remember, especially if you're nursing, the baby's not going to get much from you in the first 24 hours, and they might not even be that interested in eating that first day. They're going to be kind of sleepy. They kind of have that first golden hour after birth, and then they get kind of sleepy, trying to recover from everything that just happened. So just hold them and snuggle them and rest and enjoy that time. You don't have to be doing anything with them. And we just kind of observe how they're doing as they transition over. And just try to rest, because I know when you have a baby, everybody wants to come up and see the baby immediately. And if you're tired, if you've been up all night in labor, just remember that your family's going to be okay if you tell them this isn't a good time, and come back tomorrow. The baby is still going to look like a baby in 2 days, okay? So it will look the same, and you guys need to rest. You need to rest and take care of yourselves. So don't be afraid to tell people it's time to go if they're kind of all descending on you at once. So as far as feeding the baby, I've been referencing that a lot. You have a choice, and for everybody, I think this is a really personal choice. We always encourage moms to try breastfeeding if they never have. We know that breast milk is really good for babies. It has lots of antibodies that help them stay healthy. It has great nutrition. It has some fatty acids and good bacteria. And it's easy in the sense that it's there, ready to go whenever the baby's ready, and you don't have to go buy it. But like I said in the slide, they're kind of dazed and confused the first 24 hours, so you're probably not going to feed them every 2 to 3 hours that first day. If you do decide to bottle feed, that's fine. And in that first day again, sometimes parents will say, well, I gave them a bottle and they only took, a half an ounce. That's okay. The newborn stomach is very, very small. It's like the size of their fist. So a half an ounce would fill that up. So don't worry about that, because that will stretch and they will get hungrier in a few days. Signs of hunger would be kind of this rooting behavior where they'll turn their head to the side and try to make a little sucking motion, or kind of open their mouth like a little bird. And sometimes just being kind of restless before they really start to cry. They'll just be kind of restless and moving around. So those are signs when you can maybe try to offer feedings before they're screaming hungry. The first 3 days, when you have the baby, you're not going to have a lot of breast milk. If you do breastfeed, you just have this other substance called colostrum, which has a lot of antibodies. So they call it liquid gold because it's really helpful for the baby to get. It has some fatty acids as well. The frustrating thing for moms is that there's not very much of it, and so we expect babies to lose weight after they're born. That's normal. Every hospital here weighs the baby every day, and so I'll come in and tell parents, well, you know, your baby's birth weight was 8 pounds and now they're 7 pounds, 10 ounces, and they'll have sometimes a very panicked look, and I'll say, no, that's fine, that's normal, we expect them to lose weight. So we have parameters that we're watching on our end. We get concerned if a baby loses more than 10% of their birth weight, so we're always monitoring how much weight loss we have, and we expect after about 3 to 4 days that the baby's gonna start getting more breast milk from mom, and that weight's gonna start going up. But nursing often after that first 24 hours is important because it helps tell your body that it needs to start making milk. But it can hopefully be an enjoyable time. You're bonding with your baby, you're resting hopefully, and that's what we want you to do. And every hospital here has breastfeeding specialists called lactation consultants that can come and help you when you're in the hospital, help make sure you're getting the baby latched on okay and that things are going okay. And we also have lactation consultants that we use after you go home if you're having trouble. We have some really nice, wonderful ladies who help us with that. So we definitely have resources for you if you need help after you go home. Sometimes the nice things about formula is that dad can help. It doesn't have to be mom 100% of the time. So some parents like that option, and they know exactly how much the baby is getting. They're trying always, the formula companies are trying to make formulas closer and closer to breast milk. So I think the formula they have now is better than what they were making 20 years ago. So that's a good thing. They add fatty acids like we see in breast milk and some good bacteria called probiotics. You can ask your pediatrician if you decide to formula feed which kind they recommend. I think most of us would say that the standard infant formulas, there's several brands, are pretty similar, and so I don't personally have a favorite. I just tell parents, you know, if you get a bunch of samples in the mail, I would pick one and stick with it in the beginning, because if you're switching formula all the time and then you call me and say, well, the baby's gassy or fussy and I changed the formula and what should I do? Do you think it's because I changed the formula? It may be or it may not, but the more variables you have, the more that sort of drives you crazy. So you can save those for later when the baby's older, but in the beginning I would just pick one kind and do that until you kind of get a good feeding pattern established and know that the baby's tolerating it well before you switch around. How often should you feed? So if you're nursing, you're going to feed on demand, which is usually about every 2 to 3 hours. Sometimes they want to feed more often than that. So some babies will do what's called cluster feeding. We see that a lot in the evenings where they'll just want to eat for like 3 hours straight with just, you know, a 10-minute break every hour. Kind of drives moms crazy, but sometimes that does lead to a little bit longer sleep in the middle of the night. And if you're bottle feeding, you can go up to a maximum of 4 hours. We don't like you to go longer than that between feeds. And usually about 1.5 to 2 ounces at the beginning, every 3 to 4 hours. Your goal for most babies based on their weight would be about 14 to 16 ounces in a 24-hour period. And that's just in that first kind of week of life. But we kind of base that goal on their weight. So if you have a really big baby or a really small baby, your number might be a little bit different. And what kind of bottles should you buy? You want to use a nipple that is a slow flow. Some nipples are designed for older babies that can drink and swallow faster. And so if you put that on for a newborn, they're going to get kind of flooded with milk and choke and sputter. So you want to make sure the nipple is slow flow. And then we are kind of encouraging this to avoid the BPA. So we know that's a chemical in some of the plastics that can leach into the milk and cause some later problems with our endocrine, with our hormone system. So we like you to stay away from BPA, which I think is kind of out of all the bottles now anyway. So what else are they going to do for you when you're at the hospital before you go home? You're going to be watching the weight. You're going to be feeding the baby. All of our hospitals in town, this is a state law, are going to do a hearing screen on your baby, and that's just a little probe that they're going to put in their ear, and it's going to measure a sound wave going into the ear and how that sound wave is bounced back out to the sensor. So the baby doesn't have to do anything except lay there, and it will tell us whether that baby's eardrum is moving and conducting sound appropriately. So if we have a baby that fails a hearing screen, what we do is refer you on to get another hearing test when they're about a month to 6 weeks old. And those can be done at several different places around town. Children's or Boys Town usually is where people go. And then if that one's failed, then we talk more about, well, is there really a true hearing loss here? And we go down that path. But that's pretty rare. The vast majority of the time, our patients pass their hearing screen. But it is helpful. I've had a couple over the years that have been picked up with some hearing loss that way. And that's great because then we know before they're learning how to speak, we can get them some devices to help with their hearing so that they can develop and hear things appropriately when they're learning how to speak. We do a newborn screen on all babies in the state. That's mandated as well, and that's a little poke of their heel, and that's to take a little blood sample, and they send that off actually to Baylor, and that screens for about 30 different diseases. Most of those are what we call metabolic diseases, and so those are problems with the way your body breaks down sugars or proteins or fats. And most of these babies, you would not know anything was wrong with them. This is not a disease that we can pick up by our exam. So the only way you would know is to do this test. And the reason that this is such a big deal is if this baby does have one of these metabolic disorders and you start feeding them some of our standard foods, it can cause seizures or brain damage or low blood sugar. So it's very rare for them to have this, but if they do have it, it's the sooner we know the better, and then we modify their diet. That screen also checks for sickle cell anemia, cystic fibrosis, thyroid problems. So there's like 30 different things on there, and we will get that report in our office. It does not come back while you're in the hospital, so it takes about a week to 10 days to come back. And then I usually have it by the time the parents come in at the 2-week check, and I say, hey, I just wanted to let you know the newborn screen was normal. And obviously if it's not, then we let you know that too and what we need to do. Depending on what's not normal, there's usually a follow-up test that we have to do to figure out what's going on. If you have a boy and you want him circumcised, that's usually done in the hospital. Depending on who the doctor is, sometimes the pediatrician does it, sometimes the OB does it. It varies. So you can ask that ahead of time if you'd like, but most of the time that's going to be done before you go home. When you go home, when you care for a circumcision, you're going to put Vaseline either on the diaper or on the penis where it was circumcised, and that's just to prevent that area getting rubbed or irritated from the diaper so that it can heal. And it's very normal for it to look a little bit swollen and kind of have a yellow crusty scab on it. That's fine. Usually by 2 weeks they're all healed up and look normal again. So we just have you do Vaseline until that all heals. And when you bathe them, you kind of want to avoid that area. You don't want to scrub at it because you don't want to disrupt that skin that's trying to heal. So if you need to clean it, I just tell parents to drip a little water on it with a wet washcloth and rinse it off that way. And then we're going to monitor the weight loss. As I talked about, we would worry if they lost more than 10% of their birth weight. So we calculate that. You don't need to. And we'll let you know if we're concerned and what we need to do. And then most hospitals monitor the baby for jaundice. That's a yellow color to their skin, and that's a problem with usually coming from the blood cells, the red blood cells. As they break down, they release a pigment called bilirubin that makes your skin yellow. And there's many different reasons why babies get jaundiced. A lot of babies get jaundice just because they're a newborn baby and their liver, which is supposed to handle that bilirubin, doesn't handle it well. And so they have an increased level of bilirubin, and we see that in their skin. But sometimes they can get more jaundice if they have a lot of bruising at delivery, if they aren't feeding well and aren't peeing and pooping, because that's normally how we get rid of bilirubin. Or if they have a different blood type than mom, sometimes mom's body can attack the baby's blood cells and make them break down and release bilirubin. So we're checking for that, and we'll let you know if we have a concern about that. But just because they have jaundice, it doesn't mean it's a terrible thing. A lot of babies have jaundice. As far as circumcision, I always leave that up to the parents. I really think that's a personal decision. The American Academy of Pediatrics kind of spoke out that they recommended it if parents were considering it, but it does have sort of a mild evidence for a health benefit, decreases the risk of penile cancer, but that's a really rare cancer in the first place. So I think at this time, it's whatever you guys as a couple decide to do. And I kind of talked about the care already and who would do that. Usually if you decide to do it later on, if the baby's older, they actually have to put them under anesthesia to do it. When they're a newborn, we can just numb them up with local anesthesia, and we have a little board that we Velcro them to that holds them still. But when they get a little older and roll around, then you can't do that, so then you have to have them under anesthesia. So it can be done later if you're not sure if you want to do it now, but you just have to know that it would be more of a surgery at that time. I talked a little bit about the jaundice. So that's the increased level of bilirubin and increased turnover of RBCs. That's our shorthand for red blood cells. And a liver that can't quite handle that, can't process the bilirubin. The way most hospitals check for that, or screening for that, is with a little sensor that we shine on their forehead or on their chest. It's a little light, and that gives us a reading. We get concerned if the level gets close to 20, but we know that usually if they're going to have jaundice, it's going to increase until they're about 4 days old, and then it should level off and start to go down. So if your baby has a bilirubin of 18 on the first day, that's probably not good. If your baby has a bilirubin of 14 on the 4th day, that's fine. So it depends how high it is, and it depends how old they are. And then we decide how often we need to recheck it. If it's going up pretty early on, we're going to have to recheck it a lot, so they might get poked a lot. Usually the way we confirm jaundice is with a little blood test of the heel poke. So we might have to do some pokes. And the way we treat it, if we need to, is with a special light. It's called phototherapy. It's a little blanket with a light in it. Or sometimes it looks like, there's another one that looks like a little baby tanning bed. That one's a little bit stronger light. And most of the time, if they have jaundice after you've already gone home that we need to treat, we can do that at your house, and our home health people just bring it to you, show you how it works, and then you have the baby in the little tanning bed or wrapped up in the blanket with the light. And then they come back the next day and they draw their blood again, and they take it to the lab for us, and then they call us and tell us what the number does, and then we tell you if we need to do another day on the light or if you can take it off. So it's usually pretty easy and not terribly stressful for parents. If it gets very close to 20 or over 20, sometimes you have to go in the hospital to get stronger lights than you can do at home. So sometimes you have to go back to the hospital for that for a day or two. So usually, when do you go home? So on the day you go home, that's going to be usually 2 days or sometimes 3 after a vaginal delivery, 3 to 4 days after a C-section. You should have all your doctors, your pediatrician and mom's doctor should be coming in to see you and talk to you that day before you leave, so that they can tell you all these instructions we need you to know and when they want you to come back in after you leave. And so I always have a little talk that I give parents the day they go home about what things to call me for, what's normal, how you're going to take care of the circumcision, how you're going to take care of the umbilical cord, where you're going to have the baby sleep. If we are having a home health issue because of jaundice or a weight problem, sometimes we set that up before you leave. It just depends on how things are going. So then finally, you get to put that baby in your car seat and leave. Go back home, take your baby home. So again, I will say to remember not to let people overwhelm you with visitors when you first go home. Your baby will still look like a baby when it's a week old. So if you're exhausted, if you've been up all night and everybody wants to come over the first day, just tell them, hey, we haven't slept, we need to sleep, and could you come in a couple days and bring us dinner? But don't be afraid to take a nap. When the baby's napping, you should lay down and rest, especially mom. You should rest whenever you can. Don't worry about the laundry or the messy house. If there's a grandma that wants to come and stay and do all those things for you, that's great. Grandmas are awesome at that, so let grandma come and do the cleaning and the cooking and let you guys rest. Make sure you drink lots of fluids, mom. We know that that helps your breast milk come in. The more fluid you can drink, the more that'll help. If you're dehydrated, your body's not going to give as much fluid to breast milk. And I think usually in the hospital they give you those big giant mugs and they're always filling them up with water, so they send that home with you. So keep your mug by you and drink lots of water. Oatmeal is also supposed to help your milk supply, so if you like oatmeal, that certainly can't hurt you. Put your feet up and just, hold your baby a lot, because I think a lot of, people that mean well tell you, oh, well, don't hold the baby too much, they're going to get spoiled. But you can't spoil a baby when they're this little. They need to bond with you. So if you want to hold them, because they're not going to be little for very long. And if they're crying, hold them. It's later we can talk about when you need to cry it out and when, that's okay to separate from mom. But right now, if you want to hold them, you should hold them. If they're crying, hold them. So when you come see us, so I always tell you the day you leave the hospital, this is when you need to come and see me. And every baby's different, because every baby, it depends on what they look like the day they leave. So if this baby that I'm sending home has lost 9% of their birth weight, then I probably want to see them the next day, because I want to know if they're still losing weight or if they're going back up. If the baby that's going home today on the second day of life has a bilirubin of 17, well, then I'm probably starting phototherapy. But I'm going to see them soon too. So it depends how they look. If you have a bottle-fed baby who's doing well, isn't jaundice, eating well, hasn't lost very much weight, I might not need to see you for 2 to 3 days after you go home. So that first visit is for us to just give the baby another good once over. We're going to listen to their heart, listen to their lungs, check how their umbilical cord's healing. If they have a circumcision, check that. Look at their skin color, see what their weight is compared to birth weight. Talk to you about how they're eating, how's feeding going. How many wets are you having? How many poops are you having? And that's always, I think, the hardest visit for parents, because that 3rd or 4th day after your baby's born is usually the worst day, which also usually is the first day you've been home. So it's a hard day because you don't have the help in the hospital. And so I have lots of parents who are very exhausted, or moms that are a little bit tearful. And that's okay. And, that's a part of the job that I really like, because I feel like they need just to hear some good reassurance and tell them that this is normal how you're feeling, and I understand, I've been there, and it's okay. If you cry, it's okay. If you're exhausted, it's okay. And so we try to see where we're at, and if the baby's doing great, then I don't need to see you back until they're 2 weeks old. And if we're having issues with feeding, maybe we get you set up with lactation. If we're having issues with jaundice, maybe we need to treat that, or any other issues that we're having going on, we're going to try to address those. And sometimes babies come back to see me more often than that 2-week visit, depending on what's going on. But if everything's good, then you come back at 2 weeks, and that HCM stands for healthcare maintenance. So that's, again, our head to toe exam. We're going to look them over and see how they look now. You should be a little bit more in a groove at 2 weeks. You should have a little bit better idea of how feeding's going. Hopefully you're a little bit more rested. You might have some questions about tummy aches or pooping or sleeping. So those are things we go over. We'll talk about the newborn screen. We do like the babies to be back to their birth weight at their 2-week check. So we know they're going to lose weight. We give them time to get it back, and we like them to be back to birth weight at 2 weeks. So that's another thing we talk about. If they're not back to birth weight, then we have to figure out, why are they not back to birth weight? Is it a feeding problem? Is it not enough breast milk? Are they spitting up everything we feed them? So we talk about those things, and sometimes we have to do more appointments to sort that out later. And then the next visit after 2 weeks isn't until 2 months, so that's a 6-week interval from when you see me at 2 weeks to 2 months. And that's when we start our first set of immunizations, along with another healthcare maintenance visit. So we're going to check the baby over from head to toe, weigh them, measure how long they are, measure how big their head is, plot those on our growth curve, talk to you about their development, and ask questions about what they're doing. And that's the same thing we do for all those baby well visits all the way through the first 2 years of life. We're going to ask you questions about their development, questions about what they're eating, how they're sleeping, peeing and pooping, and see how they're growing. So that's kind of the first visit there. A lot of babies end up seeing me between the 2-week and the 2-month visit for lots of different reasons. Tummy troubles, feeding troubles, maybe a congestion or cold. And sometimes I want to see them back because I have concerns about how things are going. So we kind of decide that together, and parents can always call us if they need us to check the baby before the 2-month visit. Pooping and peeing, you didn't probably think you were ever going to be this interested in someone's bowel movements and how often they pee until you have a baby. But we are, so that's every day of my life I'm asking about pooping and peeing. So babies are really good at this. In the first couple days after you have the baby, they're going to poop this really tarry, sticky stuff called meconium. That's the poop that they had when they were inside mom. And normally they don't poop until after they're born, but sometimes babies who are in distress when mom's in labor can poop still inside mom. And so then the fluid, the amniotic fluid, will look kind of green or brown. And then you'll hear someone say, oh, there's meconium in the fluid, which may or may not be a bad thing, but that might perk somebody's ears up, or you might have a couple extra people at the delivery to just look the baby over a little more closely if they see meconium in the fluid. So that first 24 hours, we really only want the baby to have one bowel movement and one wet diaper. We're happy with those. If they have more, great, but we don't expect them to have more. This 4 to 10 wet diapers a day usually starts on about day 4. So the rule is sort of each day of life until day 4, you should have one more wet diaper. So the first day, 1 wet diaper, the second day, 2 wet diapers, the third day, 3 wet diapers, and then hopefully by the 4th day, your milk is in, they're eating more. and you're going to start having 4 or 5 or 6 wet diapers a day. Pooping, I think, drives parents a lot crazier than it drives me. Sometimes I think parents think I'm not as concerned as I should be about their child pooping, but after that first kind of initial period, we make sure plumbing's working okay, then babies can have 1 poop a day, or they can have 1 poop every week, or they can have 10 poops in 1 day, and most of the time all of that is normal. So breastfed babies, are you going to have usually a yellow, mustardy, seedy looking stool. Formula fed babies, it's going to be more of a green or brown. Those are all fine. So after that meconium comes out, it should kind of turn to one of those colors, and that's what you should see. But parents get very worried if the baby doesn't poop one day. They call, my baby didn't poop, what should I do? Usually it's fine. So we have some questions we ask you about that, or things we tell you, call us if this happens. But our question, what is constipation? So I get this all the time. Well, I think my child's constipated. I say, okay, well, how often are they pooping? Well, they go every day, but it seems like it's really hard for them to go. Well, what does their poop look like? Well, it's soft and smushy and soaks into the diaper. Well, then by our definition, they're not constipated. They're just figuring out how that system works and how to relax and let everything come out. So constipation for us isn't always the same as what it is for parents, and we'll try to teach you about that. Parents, we like to talk to you about when should you do the hygiene and bathing. When you have a newborn, 2 to 3 times a week is fine. You want to make sure your water heater is no hotter than 120 degrees. So turn your hot water on as hot as it'll go and let it run for a couple minutes, and then get a thermometer that could, just like a kitchen thermometer or something, and check and see how hot the water gets. And if it's higher than 120, you need to turn your water heater down so that it doesn't heat the water quite as hot. The reason for that is because a temp over 120 degrees can scald a child in just 1 to 2 seconds. So if you hadn't checked the temperature and you laid the baby in the tub and realized when you laid the baby in the tub that it was hot and pulled the baby back out, it might already be that some damage was done. So you want to make sure that you're checking the water before you put the baby in, but also that you just can't get it that hot. Until the umbilical cord falls off, we want you to just do a sponge bath. The biggest thing about the umbilical cord is you just really want to keep it as dry as you can. If you get water in there, it gets really stinky and gooey and just is kind of gross. So just let it fall off on its own. We don't usually clean it with alcohol anymore. We used to tell parents to clean it with alcohol several times a day. The only time I tell parents to do that now is if it starts to get really gooey and stinky, then I'll have you do that with a Q-tip and some rubbing alcohol around the base of the cord. And if it does start to smell or have a discharge, or you see redness on their abdomen, then we like you to call us so that we can take a look at it. Very rarely those can get kind of more severely infected and make a baby really sick, but I've only seen that like once in 10 years. So it doesn't happen very often, but we like to look at it if you think there's a problem. If it hasn't fallen off by the 2-week check, I usually put a little medicine on it that I have in clinic that helps it dry up and fall off. So if you don't want to mess with it, I'll do it when you come. As far as the nails, babies have these really paper-thin little fingernails that peel and get really sharp edges, and they scratch their face. That also drives parents crazy. You can kind of take your little clippers and just clip those sharp corners. You can use like an emery board or nail file and just file them a little bit. If you're mean like me, you can pull them off, pick them and pull them off. That's what I did to my children. But they're very thin and papery, so it's not hard to get them off. The hardest thing is if you get too close, they'll bleed a little, and if that happens, it's fine too, but I think you just feel bad if you make it bleed. These are the things that I'm always telling parents when I give you your going home talk. These are the things I want you to call me about. These things you have to call. So if the baby has a fever, that's really concerning to us in that first 2 months of life, because we know that a newborn doesn't have a very strong immune system yet. They can go from having sort of a minor infection to a major infection in a short period of time because their body isn't good at handling any infection. So if the baby has a fever, that's a big deal. It's not as big of a deal to us when a 2-year-old has a fever, but a newborn it is. So if you think the child feels hot or seems really irritable, not wanting to wake up and eat like normal, We want you to do a temperature, but we want to do a rectal temperature. The reason we want to do it rectally is because that's the core temperature and that's the most accurate way to check. Checking under the arm, in the ear, on the forehead, the pacifier thermometer, those often do not give us an accurate core temperature. And all of these things that we base our evaluation of the baby on do somewhat relate to what the temperature really is. So you need to just go buy one of those rectal thermometers at Walgreens. They're like $5. And you'll keep that in your baby's bedroom or by the changing table. And you're just going to lubricate the tip with a little Vaseline or KY jelly, and then you're just going to put it in their bottom until you can't see the metal tip anymore, so it's like not even a centimeter. You're just going to put it in a little bit. And the number that we consider a fever is 100.4 Fahrenheit, which is 38 degrees Celsius. That's a fever, 100.4 or higher, rectally. You don't add a degree, you don't subtract a degree, you just read it off the thermometer. That's the number we want to know. At the hospital, they will usually just do temps under the arm in the nursery, or when the nurse comes in your room to check the baby, they will not do every temperature rectally. Is that as good of a way? Probably not. Are most of those babies having a fever or signs that we're worried about a fever? No. So usually what happens in the hospital is if the nurse is worried about how the baby's acting or think the baby feels warm, they'll do a rectal temperature. Or if they get the temperature under the arm and it's high, they'll do a rectal temperature. But you also have to remember they're checking your baby's vital signs like every 4 hours, so it would be a little bit invasive to do a rectal temperature every 4 hours. But at home, I don't want you to check it unless you think something's wrong. So you shouldn't have to do it all the time. You're only going to do it if you think there's a problem. And that's a fever is an automatic visit to the pediatrician, or at night or on the weekend you need to go to the ER because there's tests we actually have to do on a baby that young that has fever, and usually they have to stay in the hospital with us for a day or two while we figure out what's wrong and how ill they really are. I usually tell people to go to Children's ER. If you go to one of the outlying hospitals, they generally won't admit children this young, and so they'll just send you to Children's anyway. UNMC does admit young children, so that would be another place you could go. But if you go to Lakeside or Midlands or Emmanuel or something, they are not going to keep you there anyway. If you've had a baby that looked a little bit yellow and the doctor said, oh, we checked it, it's fine, and then 2 days later your baby's looking like a pumpkin, you need to call and let us know. Sometimes that can change even when we don't think it will, and we want to see you back so we can reassess. Usually the rule of thumb is the higher their jaundice is, the more down their body the yellow color goes. So if it's just on their face, it's usually not too bad. If it looks like their thighs are yellow, then their number's higher, so we want to hear about that. If your baby's going longer than 4 to 5 hours and not waking up on their own to feed, then we want to hear from you. They should be asking you for food every 2 to 4 hours. So if it's like, gosh, the baby's been sleeping for 7 hours and we can't wake them up to eat, that's a concerning sign. We want to hear about it. Vomiting that's shooting out across the room and hitting somebody sitting across the room is concerning. So is vomiting that's green. So if they do spit up, it should look just clear or white or kind of yellowish. Sometimes breast milk is yellowish, but green throw up like bile can mean they have a blockage in their intestine. So green throw up, you have to call us right away, or you have to go to the ER. That's another concern. Sometimes when moms are breastfeeding, they will have sore nipples and they'll bleed a little, and when the baby breastfeeds, it'll swallow mom's blood, and the baby will spit up this breast milk streaked with blood, and that alarms the parents, but usually it's actually not that big of a deal because that is just mom's blood that the baby swallowed and then spit up. So usually that's okay, but you can certainly call about it, but that happens more than you would think. That soft spot on top of their head, if you ever see it bulging up and out, that can be a sign of meningitis. Please call us. If the baby is inconsolably fussy, you have tried everything. You have tried feeding, you have tried changing, you have tried rocking, swaddling, bathing, going for a car ride, the baby won't stop screaming. That can be a sign of infection too, even in the absence of fever. So if your baby will not stop crying, please call. We would always err on the side of checking that baby out versus telling you just to get through it, because that can sometimes mean a bad thing. Sometimes it's fine. They're just having a bad day, they have some gas. We'll try to assess that for you. That shouldn't be something you have to decide. Let us, the professionals, decide that. And then just try to make sure that everybody cleans their hands. Don't let your sick friends and family come over. Don't let the toddler who's had a snotty nose and 102 fever for 3 days, come over and kiss all over your baby. Okay, try to keep them away while they're ill. In this season, I really recommend everybody get a flu vaccine. Moms, dads, grandparents, anybody who's going to be a caregiver for the baby, please get a flu vaccine. Your baby can't get a flu vaccine until they're 6 months old, so if you're having a baby this fall, they're not going to be able to get a flu vaccine for this season. So protect everyone around them, and that'll keep them healthy. And if mom's breastfeeding, then her breast milk will give some of those flu antibodies to the baby, and that helps too. And then most hospitals are now going to also give mom a whooping cough shot. That's called Tdap. It stands for tetanus and pertussis. Pertussis is whooping cough. We know that babies who get whooping cough can get really sick and die if they get it. And the most common way they're going to get it is from one of their caregivers. So moms, dads, grandparents, again, should get that Tdap shot. And most places are going to give one to mom before she goes home from the hospital after she has the baby. But dads, you're kind of on your own. So, and a lot of dads I find who are young, in their 20s and 30s, don't really have a doctor. So then they say, well, I don't know where I'm supposed to go. You can go to Hy-Vee, Walgreens pharmacy, Kohl's pharmacy. You can just go in and get the shot. But we want to protect the baby. And usually the grandparents haven't had a Tdap for like 40 years, so they really need to get one too. Fussy baby, all babies are going to cry at times, and that's how they communicate. Sometimes as you get to know your baby, you're going to notice that different cries mean different things. So the hungry cry is going to be maybe more frantic. Sometimes my first son just would scream like you were cutting off his arm when he would wet his diaper. It was horrible. As soon as you changed him, he was fine. So they have, sometimes it's just fussy. I'm tired. I need to go to sleep and I can't settle down. I want somebody to hold me, that cry. So there's all these different things. Overly tired, MSPI stands for milk soy protein intolerance. That's not super common, but something that some babies can develop where they have an allergy to milk protein or soy protein. Reflux, where they have like a heartburn type pain, hungry, wet, cold, all those type of things. Remember that babies like to be swaddled tight. This is kind of a newer thing we're learning. It's bad for their hips to swaddle their legs really tight, so you don't want to keep them swaddled like those little papoose babies that you see carried on their mom's back. You want their legs to have some movement, so you're not going to swaddle them 24 hours a day. You want them to have times where their legs are free. But if the baby's fussy, go ahead and swaddle them up for a little while, get their arms and legs tight in there so they can't move. That makes them kind of frantic sometimes. You want to recreate the womb. You want them to think they're back inside mom. And part of how you're going to recreate the womb is you're going to swaddle them. You're going to kind of hold them on their side. You're going to do kind of a shushing sound, shh, shh, shh. And you're going to sway side to side. Remember when mom's pregnant, that baby's just swaying as she walks, and that's soothing for them. A pacifier to suck on helps sometimes, or their thumb, or their fist. There's a book called Happiest Baby on the Block. That's where those 5 S's come from. So, and like I said, you can't spoil your baby in the first 3 months. If they're crying and you want to hold them, hold them. You don't have to hold them for every cry, but certainly if they're fussy and your urge is to hold them, please do that. If you think they just need to work it out for a couple minutes and you want to try it for a couple minutes and let them cry it out, that's fine. But usually if they're crying more than 10 minutes in that newborn period, I think you need to check on them and see what's going on. Spitting up, this is what we kind of talked about a little bit, but lots of babies spit up. That's usually normal. If they're fed a little too much, if they have an air bubble that's stuck and there's a little bit of milk on top of it, that's going to come up when the air bubble comes up. So if we have what we call a happy spitter, so a baby that's gaining weight, not usually terribly fussy, but a spitty baby, we're not usually overly worried about it. We're worried about the babies who have that vomit that shoots out across the room, the green vomit. Blood, like I said, usually not as big of a deal, but if it's happening multiple times, I have had a couple patients where they did have something else going on. So if it's happening multiple times, let us know. Babies that don't gain weight well because they're spitty, we worry that stuff is not getting absorbed, calories are not getting absorbed. Babies that are really irritable, cry all the time, inconsolable, refusing to eat, or babies that are spitting up and seeming like they're having breathing problems with it, we want to know about those things. So most of the time spitting up is fine, but we'll try to give you some tips on how to decrease that. Keeping them upright after feeds and making sure you're not overfeeding them helps. This quick blurb about milk soy protein intolerance. This usually isn't something they have at birth. We see it usually about 4 to 6 weeks of age. They'll start becoming fussy after they've been exposed to milk and soy proteins. And their intestines will become inflamed and sore and irritated, and sometimes that will result in their intestines, the lining of their intestines will bleed, and that will cause mucus or even blood in their stools sometimes. So we do want to hear from you. If you ever see blood in the poop, you should call us. That's something that we need to know about. And if they seem like they're really fussy, sometimes that's a thought we have in our head. If we've checked out other things and everything else seems fine, we might think of a problem with their intestinal tract. So usually if you can just get those proteins out of their diet and give their intestines time to heal, they feel much better, their fussiness gets better, and then as they get older and their intestinal tract matures, they can handle those proteins just fine. So usually by 9 months to a year, most babies can tolerate dairy and soy. But we do have special formulas, or if the mom is breastfeeding, she can go on a milk and soy-free diet, and that usually helps too. Sleeping, we'll talk about that a little bit, but putting the babies on their back to sleep. Babies in the beginning are always usually going to be up more at night and sleep during the day. That's because when mom is walking around during pregnancy, she's rocking the baby to sleep all day. When she's resting at night, that's when your baby's kicking you. So you have to give that baby a little time to shift around to our schedule, and that takes a couple months. So it's okay, that's why you need to sleep during the day when the baby's sleeping. And at night, when the baby wakes up to feed, try to keep it dark and quiet. Don't turn on all the lights, don't turn on a loud TV. Just try to keep the environment really quiet, and hopefully the baby will learn that nighttime is for sleeping. Feed the baby and try to put them right back down. During the day, have the lights on, make noise. Try to get them to learn that daytime is more for being awake. And colic, colic is something that some babies have, and nobody really knows why we have it. We even see that in other species besides humans. In some of the primates, we see it, like the chimpanzees and gorillas and other mammals. So that's crying for more than 3 hours a day for more than 3 weeks. It usually starts around 6 weeks of age and is done by about 3 months of age. They've had studies, they've tried gas drops, reflux medicine, different positions, taking them for a car ride, putting them on top of the dryer. They've done all these things, running the vacuum cleaner in actual studies for babies. Nothing really seemed to fix it. One baby would get better with one thing, another baby wouldn't. It was all over the place. So colic is something that we do what we can to help you and try to make it comfortable, and just remember this is going to get better, this is going to get better. SIDS, I think you're going to have to watch a video when you have your baby before you leave the hospital about SIDS. That's sudden infant death, and we know that that's a risk for our babies. Most of the time it's between 2 and 4 months, but it can happen anywhere less than a year of age. And we just want to make sure your baby has a safe sleeping environment. So you're going to lay them on their back to sleep in a bed that's designed for a baby with a firm mattress. You're not going to have the bedding, the bumpers. We would like to not have any smokers in the house. We know that increases the risk. Overheating a baby is bad for SIDS, so I think our tendency is to bundle them up and keep them nice and warm like they do in the nursery, but when you go home, if you had to err on one side or the other, you'd actually err on the side of having them a little bit cool. Keep the air circulating. If you have a fan in the room or the ceiling fan, that helps. And then falling asleep with a pacifier can be helpful. You don't need to keep it in your mouth all night, but for some reason that has been shown to help. No one's sure why. And then the other thing I tell moms is there's definitely some good data that having the baby sleep near mom is protective in that first 2, 3, 4 months of life. Not with mom, but near mom. So the bassinet by your bed is perfect. Moms and babies are in a rhythm together subconsciously. And so they've studied this, a mom sleeping, a baby sleeping, the baby pauses in their breathing, the mom stimulates the baby without even waking up. She doesn't remember she did it, but they are recording this and monitoring it. So it's actually really cool. So have your baby near you. That's okay. That's kind of what nature intended, and you're in sync with your baby. So it's okay to do that. Of course, we don't recommend you sleep with your baby. I know some people do that. If you do end up doing that, you just have to be really careful because our beds are not designed for a baby to sleep in. So we have thicker, cushier mattresses, we have pillows, we have blankets. That's a suffocation risk. So you want to have those flat, firm mattresses without a lot of bedding if you're going to lay with your baby. Babies do weird things. They do jerky movements. They have a startle reflex. They have that rooting reflex. They cross their eyes sometimes. Sometimes their little foot beats like Thumper on Bambi. So they do all these funny movements. That's because their neurologic system isn't normal. We worry if the baby's muscle tone is really, really stiff and tight, like they can't relax and lay, or they're really floppy like a rag doll. We worry about a repetitive rhythmic movement, arms jerking, legs jerking, or one side they're not using it. Sometimes we see that with certain birth traumas. If the baby's a really large baby and a little mom with a little pelvis, they can stretch and damage some nerves. That can lead to a paralysis of an arm. Sometimes a forceps delivery can damage a nerve on the face. That can lead to some paralysis of the face. The good news is most of those get better with time. The nerve will come back and be fine. But we usually are looking for that as well when we're examining the baby. But if you notice something, you're with your baby all the time, I'm not, so please tell us. So say, well, I don't think they move that arm as well, or their mouth doesn't move all the way on that side. So tell us if you see something. These are questions I get pretty much from every new parent. My baby sneezes a lot. Do they have allergies? Do they have a cold? Sneezing is normal. Nasal congestion is normal. That doesn't mean they have allergies. It doesn't mean they have a cold. Babies have tiny little nasal passages, and they just takes a little bit of mucus for them to sound really snorty and sound like Darth Vader when they breathe, because they like to breathe through their nose. So that's normal. Hiccuping is normal. Having a little bit of tearing of their eyes or crusty eyes is usually pretty normal. Babies can have a clogged tear duct that can get crusted up with old tears, and then the new tears just kind of flow out the side, and we can show you how to open up that tear duct by massaging it. Sometimes they get white stuff in their mouth, which sometimes is just residue from formula or breast milk, but sometimes it can be thrush, which is a yeast infection that's easily treated. Their fingernails get long and sharp. So all these things are pretty normal. If you have questions about your baby, please ask, but we try to reassure you that certain things, peeling skin after they're born, most babies peel the skin on their hands and feet. They have to kind of shed that first layer. Lotion will not help. You just have to let it peel off. There's lots of these newborn rashes. Erythema toxicum looks like little bug bites, like little flea bites all over their body. That happens around the first or second day of life. Usually goes away by a week or two. Baby acne, and something called milia, which is little bitty tiny white dots on their nose. Those are probably hormone related from hormones that mom's had in her system that are passed to baby. Sometimes it seems like they're worse in breastfed babies because they're getting more hormones from mom. And those generally can just kind of supportive care with gentle cleansers, sometimes a little bit of ointments, and they get better as the hormones settle down. Same with cradle cap. We have some gentle cleansers we can use for that. Sometimes we use dandruff shampoo for cradle cap. There are certain different diaper rashes. Any of those over-the-counter diaper creams are pretty good. Desitin, A&D, Balmax are fine to try. If you have a diaper rash that isn't getting better with one of those, let us know. A yeast rash usually needs a specific medication to get better, and that has a different appearance to it that we can look at and see if we think that's what it is. Sorry I ran a few minutes over, but my final thoughts are just that, this is a learning experience. We don't expect you to know everything. We want you to have an enjoyable time with your baby. We want you to enjoy your time at home with your baby if you're a working mom. So don't hesitate to call and ask questions. I know sometimes you feel silly, but I always tell parents, I'd much rather hear from you and have it be nothing than have you not call me and have it be a real problem that needed some treatment. Because sometimes it's hard to tell with a newborn. People are going to come out of the woodwork and give you advice, grandmas and grandpas, aunts, friends, neighbors, and so just nod and smile, but take their advice with a grain of salt, because what worked for their baby or what was wrong with their baby might not be the same thing that was wrong with your baby, and how they did it 35 years ago might be a little different than how we do it now. And so please ask if you're getting advice that seems different from what we told you. We can try to explain why it's different, why what we're telling you is different than what your friend told you. And just remember also to take a little time for yourself, because you still want to have that mom and dad time. Your baby, part of what's going to make your child a healthy child is if they see their parents happy together and having a good marriage. So take time for yourself once in a while. Don't be afraid to go out and get a babysitter for a couple hours so you can go to dinner. And just enjoy it because it's fun. And don't forget the other brothers and sisters if they're present. That can be difficult. Sometimes they regress a little, have more temper tantrums, don't sleep as well, forget that they're supposed to go pee on the potty when the baby's got a diaper on, they want a diaper. Sometimes they want a bottle back. Never shake a baby. You're going to get information from the hospital about shaken baby syndrome. If you're feeling like you're overwhelmed, the baby's crying, put the baby down, go outside. No one ever died from crying, right? So if you need to leave them cry for 5 or 10 or 20 minutes, it's fine. Ask for help if you need it. And we do actually have a new program that we're doing about crying. If you go to a children's physician's, we have a DVD for you about crying and what's normal. And then just have fun, because they go to kindergarten before you know it. So what questions do you guys have for me?
About selecting a pediatrician, and like, will we have to tell them to be at that hospital, or will the pediatrician be the one that's there for that days when we're in the hospital?
It depends. Usually when you select a pediatrician, I've had it all different kinds of ways. I've had people come and meet me beforehand. I've had people just call and say they wanted me to be the pediatrician at the time of delivery. Most of us go and see our own babies in the hospital, and the hospital calls us and tells us when the baby's born, so you don't need to call us yourself. And then we appear, and we just magically appear in the morning and do our rounds before clinic. But certain hospitals do have like in-house pediatricians that will see babies. If your particular doctor doesn't have privileges at that hospital, they might use the in-house pediatrician to see the baby. So it just depends on where you deliver and which doctor you choose. But it's nice. I mean, I always enjoy meeting the families ahead of time, because then I can put the name to the face beforehand. And when I go see you, at least I've met you a little bit and you kind of know how things are going to go. But I've also had it where I didn't meet them ahead of time, and that was fine too. So either way is fine. Sometimes it sneaks up on you because you're going to come meet me, and then you go into labor early, and then the baby comes and you say, oh, I was going to come and meet you, but I had the baby at 36 weeks and I didn't get a chance. So that's happened too. Any other questions or Twitter questions, or no Twitter questions? Okay. Anybody else? Yes.
Is there a certain age or anything regarding like sitting up the baby for outside of burping, I guess, but where they shouldn't be sitting up, or
to work on sitting, or
is it sit up like in the little tiny chairs that they have?
Well, they don't really have the muscle tone to do that in the beginning. So usually in the beginning, you're just holding them, or they're laying on their back. We do some tummy time, but I usually don't get too instructive on tummy time until they're about 2 months old. And then we start doing that for some exercise so they can strengthen their back and their shoulder muscles to hold themselves up. And then usually around 6 months, most babies can sit for a little bit with support. Some babies are better than others. And then usually around 7 months, most babies can sit on their own for a longer period of time without support. So you wouldn't really be able to put them in one of those little chairs right away, because they don't even have the head control. But later on, 4 months and up, usually maybe you could do it for a little bit. But yes.
There are classes like this was really helpful. I really liked it. Was there any other classes that you suggest we take before we deliver, or just maybe the Lamaze, or not the Lamaze, but the childbirth preparation or the breastfeeding?
Right. That's about it. I don't know that we have any. This is kind of the only one for children's, for newborn. You know, we have other classes for different other topics, toddlers and potty training and things like that. But you know, you can sort of get information overload. You can read all these books and take all these notes, and then it all goes out the window when the baby comes. So some of it is like learning as you go, right? We don't all follow the book. So that's the interesting and fun part of it. Everybody's different. So, well, thanks for coming, you guys. It was great.
Hang on one second. I did have one question come in from Twitter. Mike wants to know, why are they not supposed to use bumpers in the baby's crib?
The reason you are not supposed to use bumpers in the baby's crib is we worry that the baby could get pushed up against that bumper and then wouldn't have good airflow around their mouth. And so then we worry about them rebreathing the carbon dioxide that they've exhaled. And we know that that is a risk factor for SIDS. So you want the baby to have a space where they're going to sleep that is not obstructed by anything, where air can flow in there. So that's why we don't use the bumpers. Now in the beginning, when they're a 3-day-old, they're not going to be moving around in their cribs. So it's probably not as big of a deal. But as soon as that baby starts moving, then you worry that they're going to migrate from the spot you laid them in to somewhere else, and that they're going to get up against the side and have trouble. So that's why those little bassinets really usually can't use much past about 2 months, because your baby's going to start rolling around in there and it won't be as safe then. And they're usually small enough that most babies don't fit in them anyway anymore at that time. But that's why we don't recommend bumpers or blankets. We really just like the sleep sacks for sleep. We don't want to have anything that could get up over their face. So blankets you can save for when they're a toddler. And one other thing that I realized just now that wasn't on the slides, there's one other test they do. It's somewhat new. I know they just had an article about it in the paper, but there's a newborn oxygen test that we've been doing in Omaha for about a year, where they'll just take your baby sometime after they're 24 hours old, and they'll put a little sensor on their hand and foot and measure their oxygen level, and that's a screening for congenital heart disease. So screening for a birth defect in their heart. It doesn't pick up all heart defects, but we're looking for serious heart defects that lead to a problem with their oxygenation. And if they fail that test, then they let us know, and usually we either have to consult the cardiologist or get an ultrasound of their heart, which is called an echo, and that looks at the structure of their heart. So it doesn't hurt. It takes like 5 minutes. It doesn't take very long at all. It's not a big deal. Most of the time parents don't even realize they did it because they just do it in the nursery when they're doing their hearing test or taking their vitals. But you might hear someone say, oh, they passed their oxygen test or they passed their heart test, and that's what they're checking for. So that's becoming a law around the country. And it's good because sometimes babies can have a bad heart defect and you won't know anything on exam. They'll look normal and it takes a week or more and then they start having trouble. So it's really nice to know ahead of time and catch it. And a lot of heart defects are caught on the pregnancy ultrasound now too. But it's a really good, easy, quick screen. So that was one thing I need to update those slides because it's not in there. Well, thanks for coming. Let us know if you have any questions. I think any pediatrician and children's would be happy to have you guys. We love watching kids grow up. That's what we do, and it's a fun part of our job. So please let us know if you have any questions, okay? And I hope the weather gets cooler.